Extensive research has found strong associations between cannabis use and the development of mental health illnesses and disorders. Although this isn't the same as a causal link, that is, because you use cannabis, you will go on to develop a mental illness or problem, it would seem that cannabis can act as a key that can unlock a mental illness in people with a predisposition. Although it's rare, some people may experience a short-term psychotic episode, a split from reality, after a heavy session of cannabis use, lasting from a few hours to several days, characterized by disturbances in thinking, emotions, and behavior. This is known as cannabis-induced psychosis, and it usually responds well to treatment. If people don't use the drug again, it is likely they will recover and not go on to develop any long-term mental health problems. Research has also shown that risk of psychotic symptoms or disorders is higher in regular cannabis users than people who have never used the drug. It is important to note that the peak age range during which people are more vulnerable to developing a psychosis, being 16 to 30 years of age, tends to be the same age range during which people commence and use cannabis. So what about the links between cannabis and schizophrenia? Evidence suggests that there would be 8 to 10% fewer cases of schizophrenia if cannabis was not being used. Someone suffering from schizophrenia may experience hallucinations or delusions, muddled speech, making it difficult for other people to understand what the person is saying. Those with a vulnerability to develop schizophrenia, such as having a family history of the illness, should be strongly advised against using cannabis. Many long-term users report that they continue to use cannabis because they believe it relieves anxiety and depression. Paradoxically, anxiety and panic attacks are among the most common negative reactions to cannabis. There is a stronger association between cannabis use and anxiety disorders amongst young women. Those who use cannabis have been shown to have higher levels of depression and depressive symptoms than those who do not use cannabis. There is a substantial amount of evidence to suggest that cannabis use, particularly frequent or heavy use, predicts depression later in life. Young women appear to be more likely to experience this effect.